Is your baby's diaper rash making you worry? Don't panic. Today we're breaking it down step by step. From what causes diaper rash, to simple home care, creams, and when to call the doctor, we'll give you everything you need in plain, easy to follow instructions. Stay tuned. You'll leave knowing exactly how to keep your baby comfortable and rash-free. Let's talk about diaper rash. One of the most common skin issues babies face. You'll usually notice it appearing right under your baby's diaper. The skin may look red, feel sore, or appear irritated. And it's not just one small spot. Any skin around the diaper area can develop a rash. So, what causes it? Most often, it's the skin coming into contact with urine, stool, or other irritants. And here's a key point. Diaper rash can happen with any type of diaper, whether disposable or cloth. No baby is completely immune. Here's a fun fact. Almost every baby will experience diaper rash at some point in their first years. So, if your little one gets it, don't panic. It's extremely common and completely treatable. In the next slides, we'll break down exactly what you can do at home to help soothe, protect, and prevent diaper rash, so your baby stays happy and comfortable. Now that we know what diaper rash is, let's talk about how to care for it at home, step by step. First, ask your doctor. It may sound simple, but clarifying instructions and asking questions ensures you fully understand how to care for your baby. Never hesitate to speak up. Your baby's comfort depends on it. Next, check and change diapers often. Inspect your baby's diaper every hour if you can, and change it immediately when it's wet or soiled. Remember, contact with urine or stool is what causes most rashes, so staying on top of diaper changes is one of the easiest ways to prevent irritation. When it comes to cleaning, be gentle. Avoid baby wipes if possible. Instead, use warm water with a mild, unscented soap. Rinse thoroughly and allow the area to air dry. Patting gently is better than rubbing, which can make the rash worse. Then, it's time to apply cream carefully. Use a diaper cream or ointment, and pat it on rather than rubbing. This not only protects the skin but also speeds up healing. Think of it as creating a barrier that shields your baby's delicate skin from irritants. Speaking of gentle care, always handle the skin with care. Rough rubbing, harsh scrubbing, or aggressive wiping can make the rash worse, so keep your touch soft and deliberate. Finally, avoid powders like talcum or cornstarch. These may seem helpful, but they can actually irritate the skin further, so stick to creams and gentle cleaning. Follow these steps consistently, and you'll help your baby's skin heal faster and stay more comfortable. Because a happy, rash-free baby makes everyone smile. After you've started caring for your baby's diaper rash at home, it's important to monitor their progress closely. Keep an eye on the rash for the next 2 to 3 days. This gives you a clear idea of whether the care steps you're taking are helping or if something needs extra attention. But when should you call the doctor? There are a few key warning signs to watch for. If the rash does not improve, or if it gets worse instead of better, it's time to reach out to your baby's healthcare provider. Don't wait. Early intervention can make a big difference. Acting promptly isn't just about comfort. It helps prevent complications and ensures your baby's skin heals safely. Remember, even though diaper rash is common, your vigilance can make all the difference in keeping your baby happy and healthy. Sometimes, home care alone isn't enough, and your doctor may recommend prescribed creams or ointments to help heal and prevent diaper rash. These are safe and effective when used correctly. Many of these creams contain ingredients like zinc oxide or petroleum, such as Vaseline. Zinc oxide acts as a protective barrier on your baby's skin, while petroleum helps lock in moisture and shields delicate skin from irritants. Here's the key. Always follow your doctor's instructions when using these products. Applying too little, too much, or in the wrong way can reduce effectiveness or even irritate the skin further. When used properly, these creams do more than just soothe. They protect the skin, speed up healing, and prevent future rashes. Think of it as giving your baby's skin a shield while it recovers. By following the instructions carefully, you're helping your baby feel comfortable and rash-free faster. Good news. When it comes to diaper rash, your baby's activity is not limited. That means crawling, rolling, and normal movement are completely safe. You don't need to hold your baby back or restrict play. The key is comfort first. Make sure the diaper and skin are clean and dry before playtime. This helps prevent further irritation while allowing your baby to explore and move freely. So let your baby wiggle, crawl, and enjoy normal play. Just keep the skin protected, and you'll notice the rash healing faster while your little one stays happy and active. Now let's talk about preventing diaper rash, because keeping it from happening in the first place is always easier than treating it. First, always keep the diaper area clean and dry. After washing, allow the skin to air dry before putting on a new diaper. This gives the skin a chance to breathe and stay healthy. Be gentle when drying. Do not rub the skin. Rubbing can irritate delicate baby skin and make rashes more likely. When choosing diapers, make sure they are not too tight. Loose diapers reduce friction and help prevent irritation before it even starts. Also, change diapers promptly. Wet or soiled diapers should be replaced immediately, because prolonged contact with moisture or stool is the main cause of diaper rash. Give your baby diaper-free time whenever possible. Even a few minutes can let the skin breathe and reduce irritation. Use mild, unscented soap when cleaning, and rinse thoroughly to remove any residue. This keeps the skin soft and prevents chemical irritation. Finally, be cautious with baby wipes. Some wipes contain ingredients that can irritate the skin, so choose gentle options and use them sparingly. Follow these simple steps consistently, and you'll help keep your baby's skin healthy, rash-free, and comfortable every day. While most diaper rashes can be managed at home, it's important to know when it's time to call the doctor. Some warning signs mean your baby may need medical attention. First, check for fever. If your baby has a temperature of 100.4 degrees Fahrenheit or higher, contact your healthcare provider promptly. Next, watch for signs of infected skin. This includes open sores, boils, or pus on the rash. Infection can spread quickly, so early treatment is crucial. Also, pay attention to feeding and sleep patterns. If your baby is not eating or sleeping normally, this may indicate discomfort or a more serious issue. Monitor the rash itself. If it does not improve within 2 to 3 days, or if the soreness gets worse and the skin becomes redder or more painful, it's time to seek help. Finally, watch your baby's behavior. Unusual irritability or fussiness can signal discomfort that needs medical attention. Remember, early action can prevent complications and ensure your baby heals quickly and comfortably. When in doubt, always reach out to your pediatrician, because your baby's health and comfort come first. Before you head home, there's one last step to make sure you feel confident caring for your baby: the teach back method. So, what is teach back? Simply put, After talking with your healthcare staff, you explain in your own words what you just learned. This helps confirm that everything was explained clearly, and it also gives you a chance to ask questions about anything that seemed confusing. The purpose is simple. It ensures you understand the care instructions and feel confident about taking care of your baby at home. It's not a test. It's a tool to help you and your baby. Before you leave, make sure you can do these 3 important things. 1. Describe your child's condition so you know exactly what you're managing. 2. Explain how to care for your child's skin, including diaper changes, cleaning, and applying creams. 3. Know what to do if the rash doesn't improve in 2 to 3 days, or if you notice open sores or worsening irritation. Using Teach Back gives you confidence, ensures your baby stays healthy and comfortable, and helps prevent complications. Remember, you are your baby's best advocate, and understanding care instructions is key to keeping them happy and safe. If you want to dive deeper into understanding and preventing diaper rash, there are some excellent resources you can check out. FamilyDoctor.org is a trusted source for clear, medically reviewed information. You can visit their page on diaper rash at FamilyDoctor.org, Family Doctor, N, Diseases Conditions, Diaper Rash HTML. It covers causes, treatment options, and tips for keeping your baby's skin healthy. Kids Health is another great resource for parents. Their diaper rash page at kidshealth.org, parent, infections, fungal, diaper_rash.html explains everything from mild irritation to more serious rashes, with practical advice for daily care. Checking these trusted sources can give you extra confidence in caring for your baby's skin and help you feel prepared for any situation. Remember, knowledge is power, and being informed helps your little one stay happy, comfortable, and rash-free. And that's a wrap on everything you need to know about diaper rash. From causes, care, and prevention, to when it's time to call the doctor. We hope this guide helps you feel confident and ready to keep your baby's skin healthy and comfortable. If you found this video helpful, please give it a big thumbs up. It really helps other parents find this information. Don't forget to share it widely with friends, family, and parent groups who could use these tips. Make sure you hit that notification bell so you never miss our helpful guides for parents. And if you haven't already, subscribe to our channel for more expert advice made simple. We'd love to hear from you too. Comment below and tell us your top diaper rash tips or any questions you have. We read every single comment and want to help you and your baby thrive. Thanks for watching, and remember, happy baby, happy parent.